My name is Jana Becker and I work as a senior neurologist in the Alfried-Krupp-Straße in Essen. I'm specialized in immunological questions according to neurology in general and as well in strokes. Despite its rarity, I think two things are essential. First, one should be able to diagnose the disease when it's present, and second, it's important to rule out other diagnoses in order to avoid misdiagnosis and incorrect treatment. So as for the clinical presentation, it might be unclear in the beginning because there are many neurological deficits newly acquired that could present PACNS or primary angiitis of the central nervous system. But according to the diagnostic criteria of Calabrese and Malek, they require a combination of neurologic symptoms as well as evidence in either imaging or in biopsy that proves the diagnosis. So finally, it is a combination of clinical symptoms that have a big variation and imaging features as well as histopathological features. PACNS is still a diagnostic challenge because it has a lot to offer. So, as I already said, there is a big variation in clinical symptoms and you can't distinguish by clinical examination whether somebody is having a PACNS or another cause of a neurologic condition. So if you look at the MRI scan, you have as concern for middle to large vessel subtypes, stenosis, you have occlusions in the MR angiography, as well as vessel wall enhancement, and as a result, you may see strokes and hemorrhages. As for the small vessel subtype, you rather see edema or contrast enhancement, leptomeningeal or parenchymal. So it's a very different picture and it looks very similar to maybe another neurologic condition. So you have to go further and do more invasive diagnostics to be sure you have this disease and no other disease in order to do the right treatment at the end. Well, histopathology is crucial to establish a diagnosis and to be sure of the result. And if you take the digital subtraction angiography as a gold standard for middle to large vessel variants, you should consider the biopsy being the gold standard for small vessel vasculitis because you can't see that in DSA. So if you take an area that is already affected in the MRI scan and you do a targeted leptomeningeal and parenchymal biopsy, you can exceed your sensitivity up to 80%. And considering a complication rate of about 0 to 2%, it weighs the risk versus the benefit you expect. So it's not only there to prove your diagnosis and to decide for the right treatment, but it's also important to rule out other diagnoses such as CNS lymphoma or malignancies or infections, which would need a complete other treatment.